On November 30th. So I beg you, please don't stop after the conversation. Let's keep it going on social media. I see a lot of pages from SADC to the AU Youth Envoy office and quite a few others you've been tweeting all week. So let's keep the momentum going and encourage our friends and loved ones to stay marked up. So this event has been made possible as a result of over 70 organizations that have partnered to make the campaign happen. Throughout this week, we'll be spreading this message which says, wear a mask, keep on wearing a mask so that we can stop the spread of COVID-19. Today, I'm very excited to officially introduce our speakers. I can see that they're already here. I'm going to quickly introduce Dr. John Nkengasong. Dr. John Nkengasong, he's the director of the Africa Centers for Disease Control and Prevention, and with over 30 years of experience working in public health. He previously worked with the US CDC as the Deputy Principal Director of the Center for Global Health. Dr. John, you're welcome to the call. Thank you so much for joining us. Wave to us.
Thank you. Thank you. Thank you.
You're welcome. I also want to quickly welcome Aya. I thought I had a busy schedule until I met Aya. Aya, I don't know how you do it, but I've seen your face everywhere this week on Twitter. You're also flagging up the 2063 Academy. So I just wanted to officially welcome you. She's the Africa Union Special Youth Envoy and currently sits on the independent panel on pandemic preparedness and response, which was formed by the WHO, and she analyzes and assesses the world's response on COVID-19 in order to make future recommendations and hopefully prevent future pandemic or improve future pandemic responses. Aya, you're welcome as well. Can she see us? You're welcome. Namaste. I also want to quickly welcome Gabrielle Fitzgerald. I am sure I got yours correctly. Please let me know I got yours correctly. Thank you so much, Gabrielle. She's one of the co-founders of the Pandemic Action Network, a global network of more than 50 organizations that advocate for policy changes and increased support and resources to ensure that countries are better prepared to prevent, detect, and respond to the pandemic. She's also the founder of the CEO of Panorama, an action tank that works to solve pressing global problems through audacious thinking and bold action. Welcome, Gabrielle. Such a very important role of work that you do. You're welcome.
Thanks for having me. It's good to be here.
Awesome. So we're going to quickly go into just a bit of a housekeeping rules. If you have questions, please send your questions in the chat room. There's a full team waiting to receive your questions and take your questions and respond to them. Speakers, I just want to say thank you so much for joining us today. It's great to have you here. So let's quickly dive into the session. As we know, COVID-19 cases is on the rise. I mean, locally back home here in Nigeria, we have received increasing cases as a result of COVID-19, where we thought we had experienced a decline, but it has ramped up in the past few days. So my question is to Dr. Nkengasong. We'll start with you. The situation is clearly worsening. And I mean, based on your experience, evidence-based responses, let's start with you. Can you tell me why masking is such an important intervention? Why is masking so important to prevent the spread of COVID-19?
So thank you. Let me first of all start by truly expressing my gratitude to the partners, the Pandemic Action Network and the African Youth Group that Aya leads. I think Aya, congratulations for your very strong leadership in this. And greetings, Gabriel. I mean, good to see you. I mean, it's been a while that we've not seen. We usually meet like twice a year. So I think we find ourselves as a continent at a crossroad, whereas we have done pretty much well since the start of this pandemic. As you are aware, as we speak today, about 2 million people have been infected on the continent, with about close to 50,000 deaths. That makes us one of the least affected regions of the world, but we should be very careful. And that we are going to experience a second wave, because if you compare the last 4 weeks, we have been seeing a steady aging up of the infections. I think that is not a good time. We've seen a curve increase and peak around July, and then steadily go down slowly to around October, and then we begin to see all regions creep up. So that is not good news for us. The measures that we took collectively to deliberately and with a lot of leadership from the countries fight this pandemic when we're climbing and when we're coming down the slope in August should continue to be implemented. Of course, with a balance with saving lives and saving livelihoods and our economies, for sure. My fear is that if we do not do that, all the gains that we recorded over the last 10 months will be wiped off. Let there be no doubt about it. I think Africa exercised extraordinary leadership, extraordinary coordination, extraordinary commitment and sacrifices to fighting the pandemic when COVID just hit Africa, including locking down big cities like Lagos, Johannesburg. No one could have imagined that that would happen. And locking down where you had very few cases there. Now, we now know a little bit more about this virus than we did at the start of the year, especially in February or beginning in September when many countries were infected. But a couple of things are facts. One is that masks save lives and masks reduce transmission. The second is that we have to use these measures in combination. That is, we use masks, we social distance as much as possible, and we do hand washing, and we engage the community, and so that the community understands exactly why they should be masking. And also, lastly, is that the governments must support and supplement the mask. They may come across very simple, like something that you can pick along the street, but given that almost 500 million people on the continent live with less than $1.9 a day, it can be an obvious task to get a mask. So I think it's very important that we factor that into our response. So my point is this, that this is an important initiative. My worry as I run around the continent is that I'm beginning to see what I call prevention fatigue, where some countries are not masking at all. Some are masking temporarily. My message to the continent is that COVID-19 is not over. We truly don't know how the trajectory will pan out with the second wave. We've done extremely well with the first wave relatively, but we should never relax. And I count on the youths to champion the masking message. Mask is our vaccines for now on the continent. Easy to use, easy to distribute, easy to sustain, but we count on the youths to carry that message forward all the time and show self-discipline. Thank you.
Thank you so much. So we hear that the mask is pretty much our vaccine at the moment for we young people on the African continent. So thank you so much, Dr. Nkengasong. I want to quickly move over to Aya. Aya, what's your perception of mask wearing among young people? I mean, we work closely together at the African Youth Front on COVID-19. And we really would love to hear your perception about young African youths and why it's important for them to adopt this behavior. There was a huge rise in young people wearing masks, but it's also on the decline as well. Why is this extremely important?
Thank you so much, Chidi. It's great to see you again leading. I think what's great about this platform is that young people are already leading it and you're moderating this conversation. I want to also join Dr. John Nkengasong on thanking the partnership between the different organizations in this week. And I'm really excited that we're kicking off today and building the momentum across the continent on wearing masks. And on the onset, I want to invite all the young people watching us here on Zoom to really trend the hashtag, because this is a critical time for our continent. We have done in the past 8 months tremendous work. We galvanized unprecedented collective action as African youth. So we can't give up now. We can't let our continent down. We have to continue. Our leadership as young people is a critical step to stop the spread of the virus. And we know that Africa is the youngest population in the world. 65% of the continent is under the age of 30. So we have the demographic power. We have the mobilization power. And I know it's been tough. it's been exhausting, it's been draining, especially emotionally and mentally. African youth, have been nevertheless at the forefront, showing their resilience. We have just published a paper, Africa Youth Lead Policy paper, documenting the incredible work of youth fighting the pandemic and showing that young Africans are innovating. They are producing masks, they are distributing masks in the community, and we need to support them. Also, the Youth Front have been doing amazing work, mobilizing. I remember in the World Mask Week, you and your colleagues started the campaign on Mask Up, Stand Up, Don't Give Up the Fight, just like Bob Marley's song. And I think in a matter of 6 months, we reached 48 million youth on social media using Africa Youth Lead hashtag. So young people have done a lot. But we have also, like Dr. John said, a quotient of fatigue, also among young people who have become tired of several warnings. They have slowly started to move away from following measures on mask wearing and hygiene practices. And even when masks were in use, they might not handle them correctly, especially reusable ones. And even though we've done a lot of campaigning on fake news, misinformation still prevails, stigma around those wearing masks still prevails. And so I think this week is an opportunity for young people to step into leadership again and provide that awareness, provide that information, that motivation to continue, because now we live with COVID-19. So I think for me, Africa Mask Week is a platform to remind our youth on the continent that wearing masks is an opportunity for leadership. And when we wear a mask, we are protecting our friends, our communities, and our families as well. So we just have to step up to that challenge again and continue to be resilient.
Thank you so much, Aya, for such raising such important points, and well done to the young people who I know have been very, very conscious of the campaign. And that's why we are saying today that the work, the burden still rests on us. It's not a burden, but the responsibility still rests on us to remind our friends, our family, wear your mask, put on your mask. I think that consciousness is so important in pushing forward the message. So thank you, Aya, for lifting us up with that message. I want to quickly move over to Gabrielle as well. Gabrielle, Pandemic Action Network, launched a successful campaign in August called World Mask Week. Why is this still an important issue?
Great. Thank you, Chidi. Thank you all for having me today. It's great to be here. Yeah, so as everyone has talked about so far, mask wearing is critical. There's been a lot of talk about a vaccine, but the vaccine's not available yet, and it will be quite some time before it reaches everyone. So even though people are tired of hearing the messaging, wearing a mask is going to be very, very important for quite some time to come. We at Pandemic Action Network recognized that there was not an awareness of mask wearing earlier in the year. And so we've done several campaigns to try and raise the awareness. So over the summer, we had something called World Mask Week, where we partnered with many organizations around the world. And we were pleased that people in 117 countries responded and took part in the effort. Now we're really hoping to concentrate with Africa Mask Week on the African continent. And as Dr. John Nkangasong said, there's fatigue because so many countries in Africa have avoided the big surges that we've had here in the United States. It's been easy to think, this was in the past, I can stop wearing my mask. So we're really pleased to partner with the Africa CDC and so many partners on this. And let me just share a few of the partners who are joining this campaign: the International Chamber of Commerce, the Organization of Africa Youth Kenya, WHO Afro, Goodbye Malaria, Resolve to Save Lives, Facebook, the Risk Communication and Community Engagement Working Groups, and the World Economic Forum, among many, many more. And so these are the types of partnerships that we love being part of, because these problems are so big and challenging that it's only when everyone works together that we can make progress against them. And so that's why we're happy to be here today and be a co-sponsor of Africa Mask Week.
Thank you so much, Gabrielle. So I wanted to quickly touch base with the people in the chat room so they know that we are connected to them. We're seeing their messages. You're welcome, Anne Thomas from Chicago. Maureen, you're welcome from Puerto Rico. Ruben, Mandani, I just want to welcome you all. Gabrielle, Martin, welcome, welcome, welcome. Please remember to use the chat box. Ask us your questions. Show us you support this campaign. Put on your mask, take a picture, and use the hashtag Africa Mask Week so that we're sure that you're involved and you're engaged. So thank you once more, Gabrielle. That sounds really exciting. I love the collaborative efforts. It's great to see that we are no longer working in silos and we're now working more together. I think if nothing else, that's one lesson COVID-19 has taught the world. So thank you so much. I want to quickly come back to you again to say, you mentioned youth helping to normalize mask wearing. Can this campaign be a jumping off point for that, or can we say it has already happened?
I mean, both. I mean, absolutely. I think young people are the backbone of any successful communication campaign. We are the most interconnected generation. We master the digital tools. And even though Africa, maybe 70% is offline, information can pass even with that one young person who has digital access. And we know from previous crises that the best way to mobilize collective action is by mobilizing and galvanizing young people. I think because of our demographic, young people are also everywhere. So not only we need to raise awareness of youth themselves to follow preventive measures, but young people can drive the ripple effect in the community. They can drive it in schools, in transport. They can be ambassadors of this campaign. So I think it's vital that we use the campaign to reach, inform, and enable youth to help us stop COVID-19, but also give them the tools and the resources to run this campaign and to reproduce and distribute masks in the community as youth-led organizations who have been doing tremendous work already since the start of the pandemic. I think they can influence their constituencies, and we need to meet youth where they are and encourage them to adopt this behavior and take that responsibility to be role models. And finally, like you said, on collaboration, I think Africa's response to this pandemic can be a legacy of complete shift to show how crucial and effective collaborative intergenerational co-leadership with young people can and we can advance on the continent's development because of that co-leadership, that we need your decades of experience to make wise decisions, but you also need our innovation. And only together we can get out of this crisis and beat the pandemic together.
Hello? Hello?
Yeah, I think we are still here. I think Aya disappeared.
Wow, sorry about that. Dr. Engel, so let's quickly come to you, anyway. So what does the African CDC hope to achieve through this campaign?
So we have, first of all, let me just say that I really like what I'm hearing from Aya. I think I like that intergenerational co-leadership. And again, let's face it, I think the fatigue is on. I mean, what we hope to achieve with the youth, African Union Youth Group is really to revive that awareness. And I would like to see people on the streets masked as they were just a few months ago, especially in light of what we are seeing with the trends. I think there's really a clear epidemiological evidence that we are hitting back upward. So what do we want to see during this week? We want to see continuous engagement. We don't want this to be an event for today, but this is the beginning of a process that will actually use all your networks to engage, also using innovation to engage the youthful layer of our continent so that they become the engine that drives the community. And the community here is broadly used, which include all of us, our the households, our leaders, and the private sector, the churches, the religious leaders, so that they can truly preach that message across in a sustained manner. We can beat this virus. We can only beat it if we have self-discipline to be able to wear masks and also self-accountability. We may be tired, we may prevention fatigue, but the virus, I can assure you, is not tired, not at all. The problem is the virus. The solution must be us. I think the virus is not going to say that, well, we're sorry for you. You look like you are tired, so let's declare this over. It's not going to happen.
Absolutely. Thank you so much for that. I like, are we still on? Can you hear me?
I can hear you very well.
Oh, great. So, Doctor, I love what you said. You said the problem is the virus is not tired. So we don't even have, the solution is us. The problem is not the virus. Or rather, even if the problem is the virus, it is ready and hopefully continuing. But we have to be the ones to fight it by putting on our mask and being very active. So thanks for that. Gabriel, I'm going to ask you, what do you hope to achieve with this campaign?
Well, first of all, I feel like the energy coming from Aya is already achieving so much because she's already inspiring so many of her peers across the African continent. I know from being on social media this weekend, she was already really getting the word out. So I think if we can see an increase in mask wearing, that can make a huge difference. As John said, the virus is not fatigued, and there's still a long road ahead, even though we feel like we've already been doing this a long time.
Absolutely. Thank you so much. Okay. So I want to quickly move to the chat room to see the questions that we have. Thanks a lot for the contribution, and thank you so much to everyone who has joined the call so far. We've heard from all our speakers, and I want to quickly go into the question and answer session. How much is the Africa CDC working with the African governments in regards to COVID-19 wearing of masks, as they have been, this person said there has been conflicting information that masks do not work to control COVID-19. So how much is the Africa CDC working with other African governments? Dr. Gasong, I think this question is for you.
No, a lot. Simple answer is a lot. From day one, we have been very clear. Let me just be very clear. We at Africa CDC started issuing guidelines and encouraging the continent to wear masks before any other organization endorsed that. I think at that time there was still a debate at WHO whether there was enough evidence for that. We didn't wait for that. We dashed ahead full speed. We said, look, it's not going to harm you anyway, even if later on they showed that there is no evidence for that, it's not going to harm you. And we're at war, and you go to war with what you have and not what you need. Okay, so what we had at that time was a mask. We had limited testing. As you know, we are now at a good place, but at that time we had very limited testing. Excuse me. So we preach the whole concept of wearing masks way ahead before anybody, any international organization were in. So I think it's still the same today. As I told you, we at Africa CDC have started launch a roadshow to visit countries. As we speak, the Deputy Director of Africa CDC is in Kenya. I mean, we are going with one message. We've done well, but second wave is here. Wear masks, wash your hands, social distance, and a balance between saving lives and saving economies. I think that's what we are doing.
Thank you so much. Gabriel, let me quickly ask you, is there hope in the horizon? Do you think there's hope? I also know that we still have people who still struggle to even believe that this is real. We have people who feel like when they wear a mask, their rights are being infringed upon. Do you think there's hope? Do you think never gets to a point where people are very conscious, interested, and convinced that wearing a mask is pretty much the safest we can do at this point in time?
Absolutely. I think we've already seen, I mean, when this, as John said, when this disease started, we didn't know anything about it. We didn't know any of the things that we could do to combat it. And so we've seen so many countries that have really returned back to normal life. But there are some new behaviors that we need to adopt, like mask wearing, being very vigorous about hand washing, and also keeping a safe social distance. And so we've seen that if you use these practices and are very strict and vigilant, there are many countries and many communities that are not having an upsurge. And so that's why this week, kicking it off is so important, because not only do we need the youth leadership, but we also hope the youth are going to inspire political leadership to make sure they're being an example, so that it's coming from all sides, and that it really is seen as the normal and right thing to do, even though we're tired.
Thank you so much. And then, it's a two-part question. So the first part of the question would be, what else can young people do? I mean, what other synergies can we form in amplifying our voices, especially around wearing of masks and just preaching the message of COVID-19? And in addition, how else do you think we can work hand in hand with the private sector to support maybe more, maybe businesses or ideas that are targeted towards declining the virus to the best of abilities? What else? I know there are quite a few on the call. So what else do you think we can do?
I lost a bit, but I didn't get much of the question. But I think two things. One, is we have to recognize that we might have been in a worse situation if not with the resilience of young people. So I think we need to recognize that young people are incredibly on the front line of stopping the spread of the virus. But youth need to work with their peers. There need to be a lot of mobilization of peer work and peer support and peer awareness, raising awareness among young people, because the youth that we mostly talk about, or the consultation that the Youth Front and you, Chidi, with your colleagues did, was mostly with young people who are online. But young people are also the refugees, the migrant, the young people with disability, the young women. So I think the youth have the responsibility, because we understand each other's language. We know how to relate to each other and communicate to each other, and we have the responsibility to spread that information and also combat fake news and stigma around COVID-19 to our peers. And I think the more we do that, because we're the majority, we are the face of all the communities, the more we do that, have the mask wearing as something normal and not as something that someone, as something to forget when you go out. Now it became a habit for me. I cannot get out of my door without having a mask on my face or in my bag. I should have an extra mask because I'm afraid maybe it will be ripped on the way. So I think it's just have to become some sort of behavioral change in our society as young people. And then if we see someone who who is not wearing a mask properly, we have to have the responsibility to also guide our peers. So I think that's on solidarity among young people and collaboration. But in terms of government, I think no epidemic or pandemic has been successful to be beaten without the collaboration of the population and citizens. There needs to be trust between youth and institutions. And we know before the pandemic, there hasn't been a trust. We have a crisis of trust between youth and institutions. So I think we moved the past 8 months to have strong trust with institutions, to have young people working hand in hand with government, innovating, to have government accepting a lot of youth innovation, certifying, recognizing that. At the African Union, we created the African Youth Front platform to do exactly that and collaborate with intergovernmental institutions. So we need to keep doing that, and we need the government to keep supporting youth innovations to move together.
Okay, thank you all so much. We have a few questions. I would like the French interpreter to please get ready to take the next question. Feel free to speak French. Feel free to respond in French if anyone is very fluent in the language. This is the feedback from Madani, and he says, thank you, John and I think the community engagement is crucial when it comes to ensuring universal mask usage. The community really needs to appreciate that proper mask usage is important, but also that other measures are important as well. Thank you, Madani, for that contribution. James, do we have our French interpreter in the house? Can we take the question in French and hopefully get a response in French? Is that possible?
Yes.
James, if it's possible, do let me know. Great, go ahead, please.
Interpretation, French and Portuguese. So Peter will take the question and interpret for us. Thank you.
Awesome, thank you. Peter?
The Q&A box, there's just one question there.
Okay, I think the person left it in the comment section. So kindly go through and see if you can find the question in French. I wish I was fluent. I would have just, performed a bit of magic, but sorry, I didn't complete my class in school. Okay, let's take a quick question from, there's no name here, but he says, are you ready, Peter? Okay, Peter, can you hear us? I'm going to give you 1 more minute. I can see the question here. You know what I would do? Let me copy the question out and send it to you. What's it called? Oh, I can't copy the question out. I want to send it to you privately. But see if you can see the question, because I can see the question. I just can't read the question. Okay, let's quickly move forward so we don't keep everyone else waiting. Opotu has a question, and he or she says,
Chidi, the French interpreter. You need to be on the English channel to hear him. He has seen the question. He wants to read it out.
Okay, please. My bad. Go ahead.
I heard you. I am not sure if the listening got you. Yeah.
Yes, I am. No, I did not.
Okay, you need to go to the interpretation button, then choose English for you to hear.
Yes, I'm on English.
Okay.
Okay. Okay. Thank you so much. Dr. Ikengason, would you mind stepping in, please?
Unfortunately, I didn't get a question, so
Okay, so I'm going to quickly interpret just in case. He said in the Congo DRC, apparently they haven't witnessed the disease. A lot of people don't even believe that it exists. So what would you recommend, or what would you advise in this particular situation that nobody believes it exists in the Congo DRC? Not like nobody, but very few people believe it. So what would you advise?
I think many people believe that the disease exists, that many people are taking it seriously. But we as human beings are who we are. And it's not just for the skepticism, is not only for COVID-19. If you've done public health as long as I've done, we saw it with HIV/AIDS. You see it with Ebola. I mean, even if Ebola is raging, people don't believe, or they tell you that it's something that is coming from somewhere. And I think you continue to see that. That's why the public health response and practice in the 21st century, especially for the young people like you, has to use a multidisciplinary approach. I mean, which means that we fight these diseases with the society, the community, which means we bring in behavioral scientists to explain what is driving, to understand what is driving the people that are skeptical. Okay, you bring in anthropologists so that they can understand what is going on. I think the days are gone when an epidemiologist or a virologist like me would just say that where there's a virus or some disease and everybody believes. I mean, for several reasons. Social media is there, and they put very weird stories there. And for some reason also, because of the multiplicity of information outlets, we tend to gravitate naturally towards negative news or false news. I have hardly seen in the social media, like today where the AstraZeneca published their results. I've not seen that move in the social media the way that it should. But contrary, just 2 days ago, I saw a write-up from some professor from the US that says, do not take the vaccines, COVID vaccine. It's all over. I mean, so I think what is pushing that? I think it's very dangerous. We live at a very dangerous time. That my fear is that the things that make you and I to be alive, which is vaccines, are being undermined. I think I personally received about 10 vaccines when I was growing up, and none of them hurt me. And the vaccines are the most effective public health intervention, but you see the doubts that is being created on it. So it's the same that you see with COVID-19 in DRC, in Cameroon, across the entire continent. I think some people call it the white man's malaria. I mean, I've given a run around the continent, conducted interviews, and people say, oh, this is just a white man's malaria. So I think that just to conclude, is that going forward, we should never look at the disease threats from a silo thinking, which is this has to be done, addressed by doctors. No, doctors are only part of the solution. You need to bring the community in, you bring the religious leaders in so that they can really begin to break these communication barriers and make people know that a disease will continue to emerge. I mean, people keep saying that why are all these diseases emerging? Well, I said, we have been saying with Gabriela and others that we are going to have a pandemic. We are going to have a pandemic, global health security agenda, and today we have a pandemic. Okay, and I just wrote a paper and published in Cell where we plotted new disease outbreaks that have occurred in the continent since independence, since 1960, and to now people read that. I mean, you see clearly AIDS on the continent and the chikungunya and all. So, and now COVID-19, you see that every 10 years there are major outbreaks that occur on the continent or re-emerging outbreaks there. So, because our population is dense, at independence, our population was like 300 million, the entire continent of Africa before 1960. Today, we are 1.2 billion and projected to be 2.4 billion in the next 30 years, and diseases will continue to emerge. Let's just admit that and prepare ourselves as such.
Okay, thank you very much. We have another question here. Someone is asking, how much support can the youth organizations or community-based organizations who are doing like a lot of sensitization program get in relation to the production of the commodity and distribution? I'll allow Gabrielle take that question, and then we can come back to Aya. So how much support can the youth organization or community-based organizations get, especially those who are working in inner cities or communities? How much support should they get in terms of production of commodity and distribution?
Yeah, so that's a really of many commodities like masks, other things health workers need. So there's a lot of effort to start to locally produce all of these personal protective equipment, including masks. And so I think, while I don't know of any sort of major funding that's supporting those efforts, I think it's critical, and there's not a global supply, and so the need to produce things locally is critical, and youth leadership on that is incredibly important. I think we've always seen entrepreneur and unique problem solving coming from youth, and so I hope that this will be the case as well, because there's just not a massive supply. So it really requires local manufacturing.
Thank you. Do you have any contributions?
Yeah, also to call on international partners to do support, youth innovation, because we've seen and we've documented that many, even, youth organizations that had nothing to do with health as a sector, they turned their offices into producing hand sensitizers, and then they started distributing them in the communities and for free. And we know that already youth organizations struggle with resourcing and funding. So I think the innovation of young people is there, and young people are quick to adopt, and change whatever they're doing to accommodate the crises that we live in. What is needed now, I think, is, as Dr. John said, also a multi-stakeholder and a multi-stakeholder approach. The private sector should jump in. Governments has set up a lot of COVID funds. Where is young people, space in that fund to support these youth innovations, in the entrepreneurial, and now we're also celebrating the Africa Industrialization Week. And I think it's an important message also to partners and donors to support production on the continent. So we create jobs for young people on the continent. COVID-19 also, was the result of, or the cause of losing a lot of jobs, especially in informal sector. But it could be an opportunity to also boom a lot of our businesses, whether it's digital innovation now, we're all forced to be online, or whether it's production of masks and sensitization and preventive equipment. So I think from here, it's really a call to partners and donors to support production and innovation of young people. The other thing I wanted to add is on the message of communication. I think we have the opportunity to also leverage on young people creativity in the arts and culture to communicate the message, to simplify what does it mean, and to build trust of people who are in denial of the existence of the virus. And we've seen at the beginning of the virus, a lot of, singers, a lot of, songs came out on COVID and things like that. But we've seen also during Ebola outbreak that these kind of cultural and creatives industry played a key role in passing on the message. So we need to also support those kind of initiatives where young people can speak the language of their peers and can spread the message through, creativity and culture and the creative industry. Bottom line, there needs to be some support, and it's not government only, it's not private sector only, it's not civil society only, it's when we have a partnership together.
Thank you, Dr. John. These last two questions are for you. I'm sorry, I think because you're a doctor in our midst, we all keep coming back to you with the questions. One very important question that was asked is there any negative effects caused by masks to children under the age of 5? That's a very valid question, especially a young parent with kids in that age range. That's the first question. The second question is, someone wrote or asked here that there's not been a lot of messaging from some African countries about internalizing the importance of wearing a mask. Now, how is the Africa CDC pushing ahead to, I don't want to use the word penalize, but maybe to call some of these countries to order? What are your thoughts around these two questions? Impact of mask wearing on children under the age of 5, and countries who are not willing or who have not been promoting wearing of masks as much as they should. How can the CDC step in?
Yeah, so the basic concept of mask is that you wear it to prevent transmission to the other person. And I think, of course, you yourself you are supposed to be protected, but the fundamentals is that you prevent transmission. The other thing with the mask is that do not normally recommend, usually we recommend that young children, them less than 5 years or so, wear masks because, for obvious reasons, it becomes a health hazard to them because you can choke them and stuff. So I think that is very, very clear. That's what we're doing. But if older children to adult, to young people and youth like you and older people like us who wear masks, then we are done. Then we can really fix this thing. Okay, do it consistently all the time. Now, what is African? Africa CDC enforces, Africa CDC is not a policeman, a public health, a police agency or the continent. No, we cannot. We are the creation of the head of states. Africa CDC was created by the head of states, and all the head of states supported tremendously. We've had the opportunity during this pandemic to brief them about 8 times, and they're all very supportive under the leadership of Chairperson Faki and President of the UN, Excellency Cyril Ramaphosa. So it just shows that the continental leadership, political leadership, takes Africa CDC's guidance, recommendation, and the suggestions seriously. I mean, we can only recommend to advise, advocate, and we don't have the authority to step into country X and say, hey, you are not doing this right. You have to do it right. Otherwise, we'll take you to the African Union. And no, we don't operate that way. Public health is built on trust. Okay, that is fundamental, and that's why we cherish that and trust the equity and the currency of trust is clear communication, good information, and honesty and transparency in telling the community what it is that we know and what it is that we don't know. And I think we tell you that what we know is that save lives and save slow down transmission. That is our responsibility. We also work, as we've done, to distribute millions of masks, across the continent. We've distributed that extensively across the continent, and we can only hope that everybody play their own part. I mean, we are in this together, and this is a long haul. I mean, we are going to be in this race, this journey for a very, very long haul, and it is not for our interest as Africans to allow COVID-19 to become endemic in the continent. We have our hands already full with many things, okay? The HIV pandemic is still there. The TB, issues of multi-drug resistance, issues of malaria. So but this one, we can fight it and beat it if we use masks appropriately and exercise self-discipline.
Thank you so much. And thank you all so much for engaging and asking those very important questions. As we wrap up the session in the last few minutes, I just want to quickly remind us to engage the social media kit or the social media campaign. We have it available in English, in French, in Swahili, in Arabic, in Portuguese. And all you need to do is to visit africamaskweek.com. These are already prepared templates. All you do is copy, paste, and upload on your various platforms. Remember to take a picture of yourself wearing a mask and also use the hashtag Africa Mask Week. Also, our social media campaign is still on for the rest of the week. It's from now till the end of COVID-19, actually. But we encourage you to please keep on using this message. So before we close and wrap up the session, finally, one last word from Dr. John, another last word from Gabrielle, and then we hear one from Aya, and then we will wrap up the session. So Dr. John, over to you.
Thank you. I think last word is this is a generational crisis and a crisis that will define your future as young people. So stand up and show that leadership in a sustained manner.
Absolutely. Thank you so much. Thank you. Gabrielle, please.
It's hard to beat that succinct summary, but I'd just like to thank the Africa CDC for their leadership, and of course for all the youth, including Aya and Chidi, for your leadership and for really getting this message out to people.
Thank you so much. Aya?
I want to urge all my fellow young people, my brothers and sisters, to not only share and amplify and participate, but also to step into youth power and lead by example. We don't need permission to serve our continent, and it's our hand to save our continent actually now from this pandemic. So let's do it together.
Thank you. Before we go, since we can't travel and meet each other, we're going to take a quick picture. So please, James, turn on your camera. Autumn, turn on your camera as well. Naomi, Emmanuel, Peter, Crystal, please turn on your camera. Let's quickly have one for the photo ops. We are online and this is our own conference, so we have to make it work. Pictures, people. So many cameras are not on. I don't understand what's going on. Who is wearing PJ? Oh, okay, I see. We're all ready. Thank you. Thank you. Say cheese.
Cheese.
Awesome. Thank you all so much. This was such an engaging platform. People online, you are the bomb. You're the best. Like I can see your comments are still coming. Please keep the same energy going on Twitter, on social media, on your websites, on your organization's page. We want to see it everywhere for the rest of the week. Thank you all to everyone who asked the questions. Thank you to the organizers for putting this fantastic conference together. Pandemic Network, thank you so much for making this happen. The African CDC, the African Youth Envoy, we thank you and we appreciate you. And it's goodbye from us all. Thank you.
Thank you, Chidi.
Bye, guys.
Bye.
Bye.